Why does chronic prostatitis cause neuropathic pain? Imagine a situation where pain lingers long after the initial cause is gone. That's often what happens with chronic prostatitis, especially the type known as chronic prostatitis or chronic pelvic pain syndrome. This condition doesn't just cause discomfort, it can lead to a kind of nerve pain called neuropathic pain. But how does that happen? Let's explore the science behind it. Chronic prostatitis involves ongoing inflammation in the prostate gland. This persistent inflammation activates nerve fibers in the prostate and surrounding pelvic area. These nerves are responsible for sensing pain and sending signals to the brain. When inflammation continues, these sensory nerves become overly sensitive, a process called peripheral sensitization. This means they react more strongly to stimuli that normally wouldn't cause pain. As a result, even light touch or pressure can trigger significant discomfort. Neurotransmitters and molecules like neuropeptides are released by these nerves during inflammation. They promote neurogenic inflammation, which is a kind of self-perpetuating cycle where nerves releases substances that cause more inflammation and pain. One key player here is nerve growth factor, or NGF. Elevated levels of NGF have been found in the prostatic fluid of men with chronic prostatitis. NGF helps nerves grow and become more sensitive, amplifying pain signals. This process doesn't stay confined to the prostate. The constant stimulation and releases of inflammatory mediators affect the nerve cell bodies located in the dorsal root ganglia, which are clusters of nerve cells near the spine. Changes here lead to central sensitization, where the spinal cord and brain start to amplify pain signals. This means that even after the initial inflammation has subsided, the nervous system continues to send exaggerated pain messages, making the pain chronic and difficult to manage. Immune cells like mast cells also play a role. They release chemicals that sustain inflammation and further sensitize nerves. The interaction between immune responses, nerve activity, and inflammation creates a complex environment where pain becomes neuropathic, meaning it results from nerve dysfunction rather than tissue damage alone. It's important to recognize that chronic prostatitis pain isn't just about infection or visible tissue injury. It involves a mix of immune, neurological, and hormonal factors. Psychological stress can also worsen symptoms by affecting how the nervous system processes pain. In summary, chronic prostatitis causes neuropathic pain through a series of interconnected processes. Persistent inflammation activates and sensitizes nerves in the prostate and pelvis. Neurogenic inflammation, driven by neuropeptides and NGF, amplifies nerve signals. Changes in nerve cell bodies and the spinal cord lead to central sensitization, making pain persist even after the initial cause is gone. Immune cells help sustain this cycle, creating a complex web of nerve and immune system interactions. Understanding these mechanisms is key to developing treatments that not only target inflammation but also address the nerve changes that cause ongoing pain. If you experience symptoms like persistent pelvic pain, it's essential to consult a healthcare professional for personalized care, as each case can be quite different.